from your point of view, what's the impact of the COVID-19 pandemic been like for patients with epilepsy?
Yeah, so for patients with epilepsy, and it's probably similar for a lot of patients with other diseases, they've really kind of been, wouldn't say pushed, I guess, but they've been left on the back burner a little bit, right? Because COVID has totally overtaken kind of healthcare, the noise, if you will, the use of facilities in many areas of the country, the use of personnel, and in areas where it's not been as busy, if you will, with COVID patients, it's still kind of taken over everything that's going on, right? So, so for a lot of our patients with epilepsy, that's meant things from, interruption of, planned services. So whether they were scheduled for elective procedures or surgery, those have kind of, most institutions kind of been put on hold. They didn't happen. But for many of our patients, even just kind of doing well otherwise, it's meant just like, maybe you perhaps, it's meant, they're at home and just kind of dealing with that and the anxiety and everything else. And I think in our population, many of them that's just been harder to deal with.
A different topic. We've seen what a lot of people are now referring to as COVID phobia, where people are suffering serious medical events and not going to the emergency room or seeking proper attention. Is this something that you're concerned about with your epileptic patients?
No, it is. We know that, people have been hesitant and, even where I work, and I'm sure many other neurologists, neurology offices, if you're seeing someone in private practice, don't tend to see people that are sick or infected. They're not doing primary care or, where there might be sick people coming in and people that are coming in for other things. So we tend to have clean offices, if you will, even before this. Well, we've had to kind of remind some folks, but you're right. Some folks have just been, I'm just scared to leave the house kind of thing, or, my apartment. And telehealth, I think, has been helpful there. It's allowed us to at least reach out and touch base with those folks. And, if there was significant enough anxiety to say, gosh, can we figure out, mental health people we can plug you into via telehealth, or counselors, or, somebody, if it's significant enough to help you out with this. But I think we do have to address that for each patient.
Okay, thank you for that. And now, sort of staying on this subject of managing patients during this time period, neurologists, you often work as part of a multifaceted care team or a multidisciplinary team. What has that been like in the ongoing pandemic as you've converted to telehealth more and more? I know it hasn't been the easiest transition for a lot of people. What's it like to not only take care of patients, but also work with colleagues in different places now?
Yeah, so I think, the patient part, and once we kind of got up and going with telehealth, was a little bit smoother transition. And, that went a little bit better, I guess. It's more challenging with our colleagues, because I think many of them, we were used to kind of bumping into them at the hospital or asking questions or, having easy access. And that's obviously changed. So we just had to think about it often and say, let me, put this on the stack of things that, we got to either call or we'll fax this to your doc, and ask the patients, do you have that information? We can, we'll get this, to them, and then call their office. And we've been able to do it, but you're right, that's kind of been a bit of a learning curve too, to kind of say, okay, it's changed our routine.